Hello, everyone. My name is Marie Cole. I am a student at the University of Louisville. I am a nurse. I've been a nurse for 16 years, and I'm currently getting my bachelor's degree. Tonight, I would like to do a presentation for you about knowing the signs and symptoms of stroke and what you should do if you think someone is having a stroke or you yourself is having a stroke. First of all, does everyone know what a stroke is? Okay. A stroke happens when blood flow to the brain becomes occluded. This can happen through by way of a clot or a blood vessel can burst. There is two types of if a clot happens, it's an ischemic stroke. This is 80% of all strokes are ischemic strokes. There is two different types of clots. One's an emboli. This type of clot is plaque or clot that forms in the blood, in the artery, and can break loose and travel to the brain. The other type is a thrombus. It is where blood forms in a artery and becomes thick and builds into a clot. And they block off the blood flow to the brain. The other type of stroke is a hemorrhagic stroke. The other 20% of strokes is hemorrhagic. That is when a blood vessel bursts. If a blood vessel bursts in the brain, then it leaks blood into the brain. The most common cause of a hemorrhagic stroke is hypertension, high blood pressure. Has anyone heard about a TIA, a transischemic attack? A transischemic attack, TIA, you may have heard of it as mini stroke. Many people refer to it as a mini stroke. A mini stroke is a blockage that happens that resolves in usually like 2 to 4 hours. The symptoms are gone, but you still have the symptoms of a stroke like numbness, weakness, loss of vision, trouble speaking, and loss of balance. These symptoms, like I say, they last a short time. That's why they're called a mini stroke. But don't be fooled. They are a serious warning sign that a stroke could happen. It may lead to a stroke, and you should see your doctor. 80% of strokes can be prevented by controlling risk factors. And we're going to talk about those risk factors. Barbara has handed you out some cards that we're going to go over with all of the risk factors. But first of all, I'd like to give you all a little bit of information that I have from the National Stroke Association. Did you know that stroke is the 5th leading cause of death in the United States? Every 40 seconds, someone has a stroke in the U.S. There's 7 million survivors of stroke in the U.S., and recovery from a stroke can be a lifelong process. The average stroke patient pays more than $140,000 in medical bills. Every year, stroke kills 2 times as many women as breast cancer, and our children are getting affected more. The number of children getting affected by stroke is increasing. Young boys over the age of 12, that number of those young boys having a stroke has increased more than 50% in our children. So now you wonder, what can I do to prevent a stroke? So this is the risk factors we're going to go over, and if you would, just fill those cards out for me. Or look at those cards and tally up your numbers and see what your risk factors are. The number one thing that I want to start talking about is hypertension. Is there anybody in here that has high blood pressure? High blood pressure is the most common cause of a hemorrhagic stroke, but it causes both type strokes. The high blood pressure can also cause a clot because of the pressure against the vessels and the force of the blood but that's why it's called high blood pressure. The force of the blood, then it can break loose those clots and cause them to move or travel, and that's why hypertension can cause both clots, but it is the most common cause for a hemorrhagic stroke. Your systolic blood pressure, when we talk about high blood pressure, your systolic blood pressure needs to be below 140. If you're 140 or above, you're in a great risk. You need to get that down. Your diastolic, which is your resting blood pressure, that needs to be below 90. So high blood pressure is considered 140 over 90. You need to, there's many things you can do. Medicines, if medicines need to be changed or you need to add one, that's one of the most frequent things we do as nurses and doctors for patients is get adjustments made to their medicines. Their medicines may not be working. You may have been on this medicine for 5 years, and then all of a sudden your pressures are high. You have got to get to the doctor, get those high blood pressures under control. So medication adjustments, one of the things that we frequently do for our patients to get those numbers down. Exercise, diet, exercise, watching your salt, stress, sickness, all those things affect your blood pressure. So the most important thing you can do is get to your doctor, measure your blood pressure when you can. If you don't have a machine at home, when you go to Kroger or Walgreens or any of these places, sit down a minute and actually check your pressure. And remember, if you've had your blood pressure medicine this morning and that number's still up, don't just think, well, you know, I'll just let it go and I'll check it again later. Well, check it again later, you know, or go ahead and get an appointment with the doctor and say, lately my blood pressure's been running up. I need to, you know, check it at your office and verify if it's up. So like I say, blood pressure, you want to keep that hypertension, you want to keep your blood pressure under control. And the next thing is atrial fibrillation. And this is where I lost my video before, so I will stop off right here and tie the two videos together, and thank you.